Well, happening now, vaccine boosters are available for the immunocompromised.
The FDA approved those last week. Today, though, is the second day DHR Health has offered the third shots. We're going to get to the turnout here in a bit. But first, we have some breaking news from DHR Health. Effective immediately, employees are now required to get vaccinated against COVID. We're told medical and religious exemptions will be handled on an individual basis. We got the confirmation about 30 minutes ago. September 30th is the deadline for DHR employees to get vaccinated if they haven't already. Those who don't will be suspended without pay for 14 days. After that, there are two options. You can either request an exemption or leave. DHR Health will mark those employees as voluntary resignations.
The medical facility, the first in the valley to mandate vaccines for staff. In a press release, DHR Health writing, quote, "Given the current status of the pandemic, DHR Health believes the vaccines are the most effective way to protect patients and staff and promote a healthier community," end quote. Now, while some people are hesitant to get their first shots, others are going for shot number 3.
Channel 5's Cassandra Garcia joins us from Edinburgh from the DHR vaccination site with more on that turnout.
I'm standing outside the DHR Conference Center where people have been coming in all day to get their third dose. I spoke with some of those people who told me why the booster is so important to them and their health and sense of safety. This week, DHR Health is administering a third dose of the COVID vaccine to anyone that is immunocompromised as long as they show proof. The nurses at the DHR vaccine clinic administered the booster shot to 174 patients yesterday alone. And today, more trickled in. Among those who received the third dose is Patty Fallick, a recently diagnosed lung cancer patient. Fallick says she is doing everything she can at this point to protect herself.
Don't want to get COVID. There's so many breakthrough infections that we're seeing, and we just need to be careful, and I'm like at the top of the kind of people that are going to get it and not do well.
Right now, only immunocompromised people like Fallick are eligible for a third dose.
They tended to have, at least in the preliminary studies, lower levels of immunity, thus making it much more likely that they're going to get reinfected or suffer from a relapse of a new infection of COVID with a variant that wasn't as well covered.
To get your third dose, you simply come in with proof that you're immunocompromised, and you can sit down, grab your booster shot, and be on your way. The process is simple, but the benefits can be life-saving.
I'm all for it. I don't want to get, I know some people get it and get over it, and others die. I don't want to die.
David Cardosa suffers from kidney issues. He says this vaccine not only helps him feel safer, but also makes him feel like he is doing his part.
This gives us a sense of security. You know, there's 2 shots and now we're getting the booster. So we feel that we're a little bit safer when we go out in the public. And not only that, but we keep the public safe also by getting the shots here.
The DHR clinic only offers all 3 doses of the Pfizer vaccine, but Chief Medical Officer Dr. Robert Martinez says that regardless of whether your first 2 doses were the Moderna vaccine, you can still get Pfizer as your third dose. And experts stress that you should get one of them as opposed to neither. This vaccine clinic continues through Friday. In Edinburgh, Cassandra Garcia, Channel 5 News at 6.